Hospitalizations across the state have also spiked to new records. CNN's Miguel Marquez was able to get access to an ICU in Hazard, Kentucky. Miguel joins us now. And again, Miguel, as I keep on pointing out to our viewers, you've been all around the country for the last 18 months, state to state, ICU to ICU, and here you are now this morning in Kentucky.
No one's more shocked than me. I mean, I thought I would be done with hospitals and this sort of reporting a long time ago. But look, not only are cases up in Kentucky, but in Hazard, Perry County, it has one of the highest case rates in the entire country. We visited one hospital that has tons of patients, but not enough staff.
It's morning cold, believe that.
Billy Couch didn't think much about COVID till he got it.
Don't mess around, because this ain't a joke. This is not fun and games. I've been here so long. I want to go home, but I can't go home because I can't breathe still with. This is not a game at all. When you're sitting there and you can't breathe and you feel like you're going to die.
In the hospital, 19 days now, the unvaccinated 42-year-old isn't sure how he picked up the virus. He toughed it out at home for 8 days before being admitted.
How serious is COVID?
It's bad to the bone. I recommend everybody wash their hands, do what they got to do. Stay home, stay social distance, because it's bad. Trust me, it's bad.
Until you had it, did you think it was bad?
No.
What'd you think it was?
I didn't pay no attention, to be honest, but I do now. And get your shots.
Wanda Combs manages the nursing staff in the COVID ICU at Appalachian Regional Healthcare's largest facility in Hazard, Kentucky. A nurse for 30 years, the job never tougher.
It's been very, very hard, and I get emotional because it is our community. ICU nurses work really hard. They work very hard every day, but you can usually see a difference. So you work hard and you see a difference, and that's okay. You don't care that you're tired. You've made a difference. So with this, they still work just as hard, harder, and it really hurts when you don't see a difference.
Just when they thought they were through the worst of the pandemic, it's come roaring back. Patients younger, sicker, harder to treat.
The family, it's hard for them to realize, oh, you mean this is the end? Do you really mean this is the end? It is our community. It's people that we know people they're related to. So that's what's really hard on the nurses, is the emotional part too.
In the COVID ICU here in Hazard, every bed taken by those suffering from severe cases of COVID-19. Every patient intubated except for one.
What is this virus doing to places like Hazard, Kentucky?
It's destroying us. Yeah. Everybody's getting it. Everybody's getting sick. I don't know.
Not yet. Let me look and see if Dr. Ollie has wrote.
We're just seeing a lot right now.
Appalachian Regional Healthcare has 13 facilities across eastern Kentucky and West Virginia. Its entire system now overwhelmed by COVID.
We have no ICU beds available, zero.
Zero. 13 facilities.
Across 13 facilities, we have 0 ICU beds available. We have 35 patients waiting in our ERs for beds.
Today, Appalachian Regional Healthcare has three regular beds available across its entire system. They've cleared space and made room for 200 beds that sit empty, unable to staff them.
We have applied for FEMA disaster medical teams at multiple of our hospitals. Our understanding is right now that Louisiana is in dire need, and so most of their teams are there. So we are on the list, and once they have availability, we hope that we'll be able to get support.
The hospital system needs 170 nurses today to open up extra beds. Nurses now working longer hours and doubling up on patients just to keep up.
One respiratory therapist should comfortably have 4 ventilator patients, because we work with the nurses as well. But right now I have about 7 to 8 ventilators per respiratory therapist.
Here in Hazard, patients are coming in younger and sicker than nurses have ever seen.
We're seeing much younger patients now than we did before. So we're seeing, I have patients from 20 years old today up to 75 years old. So it attacks everyone. It's not just limited to one age group.
This year, it doesn't matter. I've had several patients under 20 years old.
Under 20?
Mm-hmm.
How sick?
Very sick, actually, for their age.
Now, this hospital system thinks that their cases and hospitalizations will continue into late September, early October. and then they hope that they will start to come down. And I know I will sound like an idiot when I say, more than 95% of all the patients that are admitted for COVID in that hospital system are unvaccinated. John?
It's not idiotic at all. It's the fact, Miguel. And again, younger and sicker these patients are, and you've gone hospital to hospital, and one thing that's consistent is that the patients are unvaccinated. And when we talk about the strain on the system and what the unvaccinated are, frankly, doing to the country, it's the strain on the system that you are seeing in hospitals like this. This is why the ICUs are filled.
Yeah, we're going to get to a terrifying point in some point. So we saw this early on in New York when there were so many people that were sick. There were people dying at home, people who couldn't get to the hospital, people they could treat them if they got to the hospital, but sometimes they couldn't even get through the parking lot into the hospitals. And that's where they're heading right now. The system is completely full across the entire area. And any one thing, any more spike in cases and a bad flu season and any sort of traumatic event, it will push whole areas into the red, basically, and you will have people dying in very big numbers that basically just can't get the level of care they need.
Any reticence to treat the unvaccinated as opposed to people coming into the ICU with other things from these healthcare workers you're talking to?
No, I mean, you have the monoclonal antibody unit, and these hospitals are standing those units up as fast as they can. They can go 24 hours a day. What is the most bizarre thing on the planet is that the people who do not want to get vaccinated are perfectly happy to accept the monoclonal antibody unit treatment, which is also a brand new treatment, which is similar to a vaccine. It's just a different type of antibody that you're putting into your body in an IV drip with a much bigger needle. John?
Miguel Marquez, I keep wondering what state we'll see you from next. Thank you so much for your continued reporting on this.